Now, let's go back to this nurse, 26-year-old Nina Phan, who has now contracted Ebola in the United States. She got it from Mr. Duncan, the Liberian who died of Ebola over the past few days. There's a picture of her and her dog. A lot of people are asking me this question. Patients that she treated in recent days, should they be worried?
If she treated them before she became symptomatic, they have no worry at all. In fact, the story with her, she did it just right. She got a fever on a Friday night. She reported it the next day. She got her test. It was proved to be positive. She went into isolation. So she should be looked up to that she did it correctly. And she had only one single contact with someone after she became symptomatic. So the risk from her to other people is extraordinarily low, and that's one person who's now being followed. So she did it exactly the way she should have done it.
So when you say that one person, do we know who that person is without identifying his or her name?
Right.
And when you say followed, what does that mean?
What you do is that you monitor that person for the period of a 21-day period, where is the outer limit of the incubation period. You monitor the person with temperatures, and you monitor them to make sure they don't have symptoms.
Now, this nurse was not among those 40 or 50 people who were being examined, who had contact with Mr. Duncan, who passed away from Ebola. She was outside of that limit. But as far as we know, none of those 40 or 50 have had any symptoms at all, right?
That is true. That is true.
But they're still not necessarily completely out of danger.
They're not out of the woods. And what this patient did, when she was monitoring herself carefully, and as soon as she found she had a temperature and was feeling badly, she immediately reported it. That's very unfortunate that this brave person is infected, but she certainly did it correctly.
So this 26-year-old woman, Nina Phan, should she immediately receive some of those experimental medications or blood transfusions, somebody who's recovered from Ebola, or should they wait?
This is a decision that's made between the healthcare providers and the patient themselves. I mean, we do that all the time. Tell them that these drugs are all not proven. They're experimental. We hope they work, we don't know, and they could do some harm. So when the option is presented to the patient, we can or cannot have access to a certain experimental drug. Would you like us to give it to you? That's how it's going to work, and that's a decision between the primary healthcare provider and the patient.
Do we know for sure a blood transfusion with the antibodies or whatever, that somebody who's survived Ebola, that would make a difference?
We don't know, Wolf. There's anecdotal reports that it helps, but we don't know because there hasn't been the kind of definitive trial that proves that it actually works. So everything that's interventional with regard to therapy is still to be considered as experimental.
And finally, one last question, a variation of what I asked you before. If this was one of your relatives, a sister of yours, let's say, or a daughter of yours, would you want that person to stay in Dallas or go someplace else?
I don't think I could answer that because I would have to take a look at the Dallas situation myself personally if it were my family member and make that decision. And it would not be appropriate for me from a distance to make that kind of decision now.
Dr. Fauci, thank you so much for joining us. Thanks so much for what you're doing. You're giving us valuable information. This story, unfortunately, is continuing.
Good to be with you, Wolf.
All right, Dr. Anthony Fauci of NIH.